becomes so difficult for a pupil to move 8 kilometers from Muruti Parish to Nyakaton's Primary School.
Leaders from hard-to-reach areas want Parliament to support them in ensuring that their communities access schools and health centres. This was during a breakfast meeting between members of Parliament on health and education committees with leaders and representatives of pastoral communities of Kasese and Ntoroko districts.
The roads are not adequate, but at least at the lower lands, you can reach at every place you want to go. Unlike in the mountains, where a road is only planned to reach at an institution because of the geography of the place.
Really need to rearrange that to ensure that they are treated equally. Because there is no difference between a town council and a rural area in Karamoja. It is the same.
But the 21 first grade out of the 37 primary schools, so that talks for itself.
The leaders say they have very few schools and health centres due to difficult terrain and sparsely populated areas, which has affected the livelihoods of their communities.
On the road network, so that roads, even in the mountainous areas, can be everywhere. Because currently, the road network only leads to an institution of government, where there is a health facility, where there is a sub-county, but you can't find many of them in every villages.
6 sub-counties that are sick, and 1 town council have no secondary schools, and the distance from the secondary school, one area to another, is not less than 35 kilometers. So what happens after?
The members of Parliament, led by Alex Ruhunda, Fort Portal Municipality, and Rose Mutambi, Mbarara District, have promised to meet permanent secretaries of Ministries of Health and Education and Sports for improvement of services.
If we really want to provide better services for these people, let us not just construct a health unit and not think about the staff quarters. Let us not construct a school and not know where these teachers are going to stay. So we have to do a holistic planning.
Kabarore Research and Resource Centre presented the situation analysis of youth and women from pastoral communities of Ntoroko and Kasese, with a focus on education and health to the members of Parliament.
MPs made a commitment to meet, also to come up with a motion, especially looking at or focusing on hard-to-reach areas, especially targeting those communities as part of affirmative action, and also to organize another meeting with permanent secretaries of finance and health to discuss on those.
The breakfast meeting was aimed at amplifying the voices of women and youth for effective delivery of quality health and education services in Ntoroko and Kasese district.
The PS of Minister of Health, and then the PS of Education. We want to learn to work with the technical arm of government.
Mutonyi Hilda and Deo Habimana, UBC.
After that, if we sit with those